Good evening, everyone.
Good
Please switch on
evening.
videos. Videos on कीजिए.
गुड इवनिंग मैम.
Good evening. चलो start करते हैं with prayer. Sit straight. Make a Jnana mudra of your fingers. Try to touch tip of your first two fingers. Keep it on your thigh. Close your eyes. Gentle smile on your face. Observe your breath. Observe your breath. Inhale. Exhale with a smile. Again, take a deep breath in with a smile. Exhale slowly. Right hand on abdomen, left hand on chest. Inhale. We will chant 3 times Omkar. Om is made up of 3 letters A, U and So we'll chant differently. Inhale. 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 Feel the vibrations. Gently rub your hands. Keep it on your eyes. And you can open your eyes. Hari Om. Chalo. So we'll start today's session. Yes, good evening, everyone. So, as in yesterday's webinar, we have discussed about what is yoga, what is therapy, and how we will be using this yogic therapy in to treat our patients or to heal our patients. Okay, but as discussed yesterday, we are dealing with patients. We will be dealing with patients. We will be dealing with ill people. So we should know the details of their body, details of their disease and both. Okay, so that is why the first chapter or first session will be on case history taking. Okay, why it is necessary? Because when we take detailed case history of patient, we can go to near the diagnosis of patient. We will know the good points or bad points of that patient. We can know the cause of that disease of that patient. Okay, so that is why we need to know the case history taking. There is a specific format of case history taking. We will discuss that. Okay, so why it is necessary? Case history format provides detailed understanding of client's physical, mental, emotional health. Okay, किस वजह से उनको डिजीज हुआ है, तो ये हमें डिटेल केस हिस्ट्री लेने के बाद अच्छे से पता चलता है. ओके, we can know the contraindications of that person, particular person, that if patient is of hypertension, we will not take power yoga or we will not take dynamic exercises, dynamic asanas in that patient. Okay, so the case history taking is necessary. Second point will be personalization of yoga. Okay, see, there are two people with same disease, that I am a thyroid patient and X person is also thyroid patient. But when you take detailed case history in physical, mental and social, सभी चीजें आपको जब पता चलेगी, then you can create both thyroid patients different case history, different therapy planning. Okay, so you can plan therapy for both clients or both patients differently. Okay, so that is why we need details of case history taking. See, example, here it is given that a client with lower back pain might benefit from gentle back bend instead of intense forward bend. तो ये हमें पता कैसे चलेगा? उनकी केस हिस्ट्री से. ओके, then again वही है, the main aim of yoga, mind, body, spirit approach is that is holistic approach. We can get closer to that holistic approach. Okay. Identifying the root cause of issue, that is what, if patient is of PCOD and we take a detailed case history, we can know that if she has taken any hormonal pills or she has a chronic stress, so that is the reason of her PCOD. So we can work on her stress more than her physical elements. Okay, so that is why the identification of root cause can be possible with the yogic with the case history taking. Okay, we can modify practices and we can monitor the progress of patient. See, if patient is of knee pain and patient said that the patient is having out of 10, 8 count of knee pain or knee swelling. After 3 months, you will again take a case history. Then you can get to know that if there is a progress in their knee pain, or their knee pain has been reducted due to our yogic therapy. Okay, so to know the progression, to know the symptoms, we need the details of yogic case history taking. Okay, again, yes, definitely when we will be seeing the case history taking format. So in that format, there is some demographic data, that is first is name, then age, then gender, then occupation, then their mental elements, physical elements, so that we can create a good bond between a therapist and patient. Okay, so again, that is very important to enhance the trust and rapport. Preventing injuries, definitely. If patient is again of blood pressure and we are giving them inversions, or patient is of knee pain and we are doing dynamic Surya Namaskar, then that can that can worse their injuries. Okay, so that's why we need to take case history in detail. Again, case history format aligns with ethical practices, especially for yoga therapy teacher who work with sensitive health issue. Definitely, देखिए, depression का patient है, anxiety का patient, they don't want to share with anyone. Okay, when you take detailed case history, they can share these all points with you, and you will keep this point as a secret for them. So that is the ethical practice of yoga. Okay, so you will not share anything personal things about that patient to anyone other. And again, yes, definitely we can collaborate with alternate therapies like acupressure, like Ayurveda therapy, like diet consultation, and we can give the holistic approach to that patient to cure from disease. Okay, so these are main points of why case history taking is necessary. I'll share that those who have joined now, we are discussing case history taking. Okay. Wait, let me share that case history taking format so that you'll get to know what is that exactly. I will be sharing this case taking format in group, so no need to worry. Okay. Again, whatever we have seen till now, this is all written in this. To understand physical, mental, emotional health of patient, identify the root cause of problem, assess the suitable, specific, customized yogic therapy for that particular patient, plan an individualized yoga therapy program, and we can monitor the client's progress over the time. Okay. See, so what is format? This is the, I'll share the PDF, but here are just points are written. So first is demographic data, that full name, age, gender, occupation, marital status, and contact details. Why these are necessary? See, if you are taking case is if you are taking a yoga therapy of that patient, and if any emergency happens or you need to contact their house, then you should have their contact details, address, full name written in your case history format. Okay. Why age is necessary? See, if patient comes to you for palpitation, that their heart is beating more, and her age is 45 or 47, then the thought should come to your mind that this patient can be in perimenopausal phase and not related to heart, and we can treat her as a menopause or perimenopause patient. Okay, so that is why age is very important. If patient comes to you for weight loss, okay, and she is between age of 20-22, and if she is patient of PCOD, then you should think of that the weight gain or the fat gain is due to her PCOD, and the age is crucial at that time. 18 to 24, 18 to 28 are more prone to PCOD. Okay, so that is why age is very much necessary. See, there are two types of arthritis. We will be seeing that one is osteoarthritis, one is rheumatoid arthritis. So osteoarthritis, that is degeneration, is specifically sign of old age. Okay, 60 plus जो है उनमें हम degenerative changes ज्यादा दिखेंगे. Instead of that rheumatoid arthritis वाले patient जो है वो young patient होते हैं. So that is why to diagnosis point of view, we need to know that their age factor. Okay. Occupation. Why occupation is necessary? See, if patient is of asthma, you are giving them asthma yogic therapy, you are giving them Ayurveda medicines, you are giving them Ayurveda therapies, you are recommending a good diet, and still patient is not recovering. Okay. Then when you take detailed case history, you'll get to know that patient's occupation is something related to dust, or something related to chemical factories, something related to fumes. So that will not give relief to them. So we will advise them that you just wear a mask and you can work at your workplace. Okay. So that is why occupation is necessary. Some diseases like varicose veins are specifically called as occupational hazards. Okay. These are caused due to their long standing hours. Who are the sufferers? First is TC, ticket collector, conductors, surgeons, okay, teachers. They are more prone to suffer from varicose veins due to long standing hours. So that is why occupation is necessary. We can advise them that, see, you are a patient of varicose veins. I am giving you yogic therapy. What changes you have to do in your profession? You are not supposed to change your profession. Just 30 मिनट्स के बाद आप बैठ सकते हो. 30 मिनट्स के बाद थोड़े से काफ स्ट्रेचेस आप कर सकते हो. In that way, we can help them at their offices also. Okay, so that because this is the first format of that case taking, that is demographic data. Second will be present complaints or chief complaints. Why the patient has joined your yoga class, or why he or she needs the yogic therapy. What is the main complaint of that? Okay, the patient will not come to you with single complaint. Obviously, they'll say that मेरे knee pain हो रहा है, then back pain भी हो रहा है. I am a patient of hypertension and मेरा weight भी बढ़ा है. So these are their complaints. But what is present complaint? That should be written in this column. Okay, primary complaint, which is the most उनको ज्यादा पेनफुल वाली कंडीशन जो है वो यहाँ पे लिखनी है. And you have to write duration, since how many days, how many weeks, how many years he or she is suffering from that issue. Okay, so you have to write that. Then history of present illness. How did the problem begin? Okay. if I am a patient of hypertension and I am coming to you for yogic therapy, then what I will share with you, present complaints or chief complaint, hypertension. Okay, my history of present illness, I will share what type of history I will share, that 2 years before I was normal. After that, with sudden stress, I got my BP raised. And after that, doctor started me with the hypertension tablet. So that is the history of my present illness. कैसे start हुआ, क्या aggravating factor था उसके लिए, किस वजह से हुआ, तो ये जो चीजें हैं ये आपको यहाँ पे लिखनी है. ओके, देन पास्ट मेडिकल हिस्ट्री. नाउ यू कैन मेंशन डायबिटीज, दूसरे कोई डिजीज है कौन सी, उनको गोली शुरू है, विच अनदर टैबलेट दे आर टेकिंग ऑफ डायबिटीज, हाइपरटेंशन, हार्ट की गोली जो होती है इकोस्प्रिन वो शुरू है, तो इस वजह से विच सर्जरी ही हैज अंडरगॉन और शी हैज अंडरगॉन इन पास्ट, so that should be mentioned with medications. Okay, आपको मेडिसिन के नाम भी लिखने हैं वहां पे. क्यों? Why? See, if I am a patient of thyroid, I am taking 100 mcg of thyroid tablet. Okay. After yogic therapy, we need to reduce that dose with the help of reports and with the help of that physician. So we should know that what dose the patient is taking. Okay. Are you all getting it, or are you finding it difficult? Fast हो रहा है? Okay है दीप्ति जी?
Good, ma'am. It's good.
Okay. Thank you. चलो. Okay, okay. Okay, then why we need family history? 1 second. Okay, okay, great. Thank you. Why we need family history? Again, some diseases are genetically transferred, that is depression, anxiety. So these are genetically, this can transfer genetically. See, we have our DNA, हमारे शरीर में DNA होते हैं, and on that DNA we have that chromosome this way. Okay, this way chromosomes होते हैं. So on that chromosome, our past generations blueprints are there. Okay, the good things, bad things, सभी जो है वो chromosomes पे लिखी होती है. So if my parental parents or grandparents have that defective chromosome of depression, that will come to me with that genes. Okay, if I get the favorable stress, favorable conditions, the chronic stress, the financial loss, then that trigger, that the chromosome can trigger, and even I can be a patient of depression. Okay, so that is why genetic predisposition is necessary to know about that. If there is any family history of thyroid, BP, heart patient, cancer. Okay, in this way. क्या हुआ है? एक मिनट. Some features may एक मिनट दीजिए. चलो एनीवेज ये कुछ तो प्रॉब्लम हो गया है. सो आई विल शेअर दिस फॉर्मॅट इन ग्रुप. ओके. काहीतरी प्रॉब्लेम झालाय का बा? वेळ आहे अजून. आवाज जेवण. ओके. सो मैं एक ग्रुप पे भेज देती हूँ. तो मेडिकेशन एंड फैमिली हिस्ट्री, जेनेटिक प्रीडिस्पोजिशन पूछना जरूरी है. ओके. नेक्स्ट विल बी लाइफस्टाइल असेसमेंट. If they have any addictions of alcohol and smoking, that we have to mention in that addictions factor, diet habits, and any physical exercises which he or she has done previously or doing now. So that should be mentioned in that case history taking. Okay. What about stress level? Work and life balance उनका हो पा रहा है, नहीं हो पा रहा है? That should be also mentioned in that case history taking, so that if we find that the reason is stress, we can manage that stress easily. We have a excellent tools of pranayam, meditation, yoga nidra for managing tools. Okay. If we find the cause is muscle related, we have excellent tool of asana, stretching, sukshma vyayam. Okay. So we have, if we find the endocrine system is affected, we have tool like Bandha, Jalandhar Bandha, Uddyan Bandha, Moola Bandha. Okay. So we have tools, but we have to find out the cause of that. Okay. Then psychological assessment is necessary. Means emotional well-being, mental, physical, any psychological disturbance that we have to mention. Okay. Daily routine, you can ask in general at what time you get up, after that what time, what breakfast you do, or after that if you do exercise, do any exercise form, not just yoga but any type of exercise, walking, are you doing that? So these type of questions we can ask. At what time you sleep. If the late night sleep is there, then we have to correct it. For lifestyle disorder, the lifestyle correction is the key treatment. Okay. For thyroid, for depression, for PCOD, we need to change their lifestyle. If they want to cure or they want to get rid of that tablets, they should follow the lifestyle disorder, lifestyle changes, and we can advise them if we know their previous lifestyle. Okay. So that is why it is necessary. Okay. In Ayurveda, so we will be seeing in both ways. One second, I'll try once again if that is opening or not. Chalo, it's done. So in Ayurveda, it is called as Ashtavidha Parikshan. Okay, there are 8 types of examination which can be done to of that patient, to diagnose that patient or to go to the closer to the diagnosis of that patient. That is called Ashtavidha Pariksha or Ashtasthana Pariksha. Ashta is nothing but 8. Okay. Sthana is nothing but location. Pariksha is examination. So these are 8 types of examination which are necessary to go to near to the diagnosis of that patient. Okay, so what are they? I'll read the shlokas. If you are finding it difficult, just forget it. Here it is written in English and Sanskrit also. Okay. Roga kranta sharirasya स्थानव अष्टव परीक्षित. इजी है. देखिए, रोगाक्रांत, व्हाट इज रोग? डिजीज. क्रांत मीन्स डिजीज्ड पर्सन. शरीर, डिजीज्ड पर्सन की बॉडी को परीक्षयत, निरीक्षयत, एग्जामिन करने चाहिए. व्हाट एग्जामिन करनी चाहिए? 8 स्थानव अष्टव, 8 लोकेशन we have to examine of diseased person. Okay, which are they or what are they? Nadi, Mutra, Mala, Jiva, Shabda, Sparsha, Druk, and Akriti. Okay, we'll see one by one. So don't worry. Nadi is nothing but pulse examination. Okay, so these can be done in two ways. First will be with modern science perspective, and second will be with Ayurveda perspective. Okay, so we'll just do a 1 minute of practical. Okay, first we'll do with modern science. बाकी के सभी videos on कीजिए. Please switch on your videos. Okay. See, these are 3 fingers. These we use in Ayurveda Nadi Parikshan. Okay. If you are doing with modern science aspect, no need to take these 3. If you are comfortable, you can use it. Okay. I will be using this 2. Make a plain surface like this. Okay. And you can keep over here. This is my thumb, and at the base of thumb, you need to just press and release, so that you will find something is going from here, and that is giving a beating sensation. जैसे heart beat होता है, वैसे you will find a little bit beating of here. Okay, everybody, close your eyes. Just feel the beating of that pulse. Just press it and then keep it loose surface. Okay. Now I am starting the stopwatch. Just count that pulsation for 1 minute. Okay. Count that pulsation for 1 minute. 3, 2, 1, and start. Start counting your pulse. If you close your eyes, you can focus more. Otherwise, counting may lose here and there. Stop. राइट इन चैट बॉक्स कितने आए आपके, काउंटिंग लिखिए चैट बॉक्स में. सेवन 81, 76, 72, 72. ओके, 80, 89, 60, 76. Okay, so everybody is normal. 60 to 90 is normal. Okay, generally 72 to 78 सबका होता है, but 60 भी है then you are normal, 90 भी है then you are normal. Okay, 60 से कम है then we'll call it as आपका जो pulse rate है वो कम है. 90 से ज्यादा है so that can be find आपको मिल सकता है एथलेट्स में या फिर हाइपरटेंशन में, ज्यादा बीपी बढ़ा हुआ हो हार्ट पेशेंट्स में, तो 90 से ज्यादा हो सकता है. वी आर एथलेट्स सो वी कंडक्ट 3 to 4 योगा बैचेस और समथिंग, सो हमारा जो है 90 तक हो सकता है. Yes, sorry, sir. Yes, so 60 to 90 is normal. Okay, if you are at a borderline of 90 pulse rate, then it is also normal, because as being yoga teacher, we conduct 2 to 3 batches, 4 batches in a day. So our heart is beating more than normal people who don't exercise, who don't run, who don't walk. Okay, so 60 to 90 okay है, ये आपका सभी का है. Then we'll do with Ayurveda view. Okay, In Ayurveda, we have to again use these three fingers. Let me share one image so that you'll not get confused. Okay. So index finger, middle finger, and ring finger. We will be using these three fingers like this. See, index finger, middle finger, and ring finger. Okay, we will be using these three fingers. What to do now? Again, make a plain surface of these three fingers. For ladies, we will check of left hand, and for gents, we'll check of right hand. Okay. Now I am showing you like this. If this is my hand, I will keep that at the base of thumb, you will get a bony prominence, and below that bony prominence, you need to place second finger, index finger, then middle finger, then ring finger. Okay. Are you able to see this way? Okay. Now again, you will close your eyes and feel the pulsation that where the beating is prominent. Okay, you will feel the beat at 3 points, but the particular one point, at the particular one point, you will feel the prominence of that beat is more. Okay, chalo. Let's again do a practical.
Repeat once, ma'am.
Okay, okay, no problem.
Because you said that for ladies it is left hand. Means we have to take measure of left hand or we have to use our left hand.
No, we have to check left hand.
Okay.
Okay. Yes, just make a plane of these three fingers, index finger, middle finger, and thumb finger. Okay, we are no, sorry, ring finger. We are not using thumb and little finger. Okay, then if this is my thumb, base of thumb, I'll put here is it is a bony prominence. You can feel it. Below that bony prominence, you have to keep your second finger, index finger, then third, and then fourth. Okay, here. And after that, actually it is placed this way. Okay, so here, and after that, you need to feel the prominence of beating. If the beat is prominent below second finger, index finger, if beat is prominent below middle finger, if beat is prominent below that ring finger. Okay, this way. Chalo, close your eyes. We will again measure it, observe it for 1 minute. Okay. Close your eyes. Keep your three fingers at the base of your thumb and start focusing. Focus कीजिए थोड़ा सा. ज्यादा से ज्यादा बीट कहाँ पे आ रहा है? What is the prominence beat? Is it below second finger? It is below third, or it is below fourth finger? Close your eyes so that you can focus it. Okay, you can write in chat box. किसके सेकंड फिंगर, थर्ड फिंगर किसके नीचे आपको ज्यादा प्रोमिनेंट लगा? So that I can explain you the. You can feel both below two fingers also. Okay, it is not necessary that only one dosha will be prominent. Middle finger first, but second also. Right, that is what I was. Second and third below, index finger, middle ring, both feel bit. Okay, okay, okay. ऐसे कोई है जिनको काउंटिंग में भी नहीं आया, फील एंड अभी भी नहीं आया? It can happen due to not having a practice or less practice. Where what you have to do daily when you wake up, just keep your hand over here and just close your eyes and try to observe it. Bhook lagi when you are hungry. Try to find out your dosha imbalance or try to check your nadi. When you are sleepy, check your nadi. When you are in menstruation phase, check your nadi. In this way, you will get to know the difference. Okay, actually, this is a part of Ayurveda Vaidya, but just for the sake of your knowledge, I'm sharing this with you. Okay, so what does it indicates? Second finger indicates Vata dosha, middle finger indicates Pitta dosha, and in this last finger, sorry, ring finger indicates Kapha dosha. Okay, so if you are hungry, you can feel the more beat is find you can get the prominence of that beat under pitta dosha, because pitta dosh is responsible for our hungers. Okay, if you have any pains in your body, you will have vata dosha prominence beating. Okay, if you have hyperacidity, you will have pitta dosha beating more. And if you have cough, cold, fever, obesity, then you can get kapha dosha beating over kapha dosha. Okay, so this is actually a deep concept. We as being Ayurveda doctor worked for 4.5 years, learned this 4.5 years, then practiced over thousands of patients, and after that we can get to know the doshas, dhatus, and all. Okay, but for the sake of your knowledge, I'm sharing that this is the Ayurvedic Nadi Pariksha. Okay. Then next is Mutra Pariksha. Mutra is urine examination. Why it is necessary to ask question about urine? We will not examine their urine physically, but we will be asking them questions regarding urine, that what is the frequency of urination in day and night? What is the color of urine? Is there any foam in urine? Is there any blood in urine? Okay, in this way we can get to know the disease also. See, in some diseases like diabetes, we have the patient gets more and more urinations. Okay, the frequency of urine gets increased. The normal, if we normal patient will go for 4 to 5 times a day, they'll go to 10 to 12 times a day, 3 to 4 times a night. So that is what the increased frequency of urination. Okay, why we will ask them color? Color is the most important part of urine. It is the indication of hydration. हमेशा पूछा जाता है पानी कितना पिए. Okay, so the now modern science has given the 4 liter. You should drink 4 liters of water, 5 liters, 3 liters. But Ayurveda doesn't support these sentences as itna piyo, utna piyo, because everybody body is different, everybody need is different. Okay, so what Ayurveda says, the color of urine, if you are passing a fresh white color urine, then your body is hydrated well. Okay, if your urine color is little bit yellow, dark yellow, orange, then you need to improve your hydration with water, with juices, with soups, with coconut water and all. Okay, otherwise no need to drink more and more water and all. So that is Ayurveda view. Okay, mala, stool, again very important aspect, because constipation is said to be mother of every disease. Okay, अगर constipation है तो आपको fever से लेके cancer तक कोई भी बीमारी हो सकती है. So the frequency of stool, the color of stool, if blood is passing through stool, the stool is hard or loose, we will ask them details about their bowel habits or bowel movements. Okay, jivha, tongue, again very important aspect. Why? Because tongue is said to be mirror of GI tract. What is GI tract? Gastrointestinal tract. The tract which starts from our mouth and ends at our anus. So whole digestive system, if anything, any toxins are stuck in the our digestive system, it will reflect on our tongue. Okay, tongue, in that patient you will see the tongue will be white and coated. Okay, so white tongue, coated tongue is the indication of something is happening bad in your tummy, or the indigestion is in your digestive system. Okay, that's why tongue should be examined. After class, you all will go in front of your mirror and observe your tongue. Tongue should be light pink color, non-coated, and you should feel fresh with that tongue. Okay, the tongue should not give a bad breath and all. So you will, after class, you can observe your tongue in your mirror. Okay, shabda, that is voice, touch, sight, and akriti. Here it is given facial expression, but I am not expecting that facial expressions should be considered here. The overall appearance, overall weight, it is to be examined here. Okay, why shabda is necessary? See, if we are doing local examination of knee joint, when we when we examine that knee up and down, and if you hear the crepitus sound, or ऐसे knee से एक sound आ रही है, then you can think of कि it can be a degenerative type. Okay, in some patients the voice becomes harsh, or in some patient the voice becomes एकदम slow हो जाता है. Then you will आपको पता चलना चाहिए कि that patient can have the chronic inflammation, or can be suffering from any chronic diseases. Okay, so in chronic diseases, in long term diseases, the voice becomes slow and suffer. Okay, then sparsha, again I will go to knee patients only. Okay, when we will touch the knee patients, if we are finding that knee joint, if we touch this way, if we are finding that knee joint is hot or red in color, then we can we can say that there is inflammation. Okay, and if there is no color, no then temperature is normal, then that can be degeneration. Okay, touch is also important for skin diseases. Okay, if you have eczema patch, you can see the eczema patch is dry or soft or wet. So that is why touch examination is necessary. Drick sight, if they have any specs, or they have any their vision, diminished vision, in some diseases like eye related diseases, or in diabetic complication, you can face, the patient can face the diabetic retinopathy, sudden vision loss, sudden blurred vision. So that is also to be mentioned, that आपको कभी चश्मा था क्या, पहले आपको कैसे दिखता था, अभी आपको कैसे दिखता है. You should ask these type of question to get more and more knowledge about that patient. Okay, akriti, again what I told you, that एकदम से weight gain, एकदम से weight loss. Okay, sudden weight gain, sudden weight loss. Before 6 months I was 50 years 50 years 50 kgs, and after 6 months I gained 12 kgs. And also you should think of that sudden weight gain, it can be thyroid, sudden weight gain, it can be PCOS, sudden weight gain, it can be any hormonal imbalance. Okay, and sudden weight loss, if I am 80 kg, not 80, if I am 60 kg and I lost suddenly 20 kg and went to 45, 50 kg, then sudden weight loss can be a sign of cancer also. Okay, so we should think of that there is something critical happening in this patient's body, and we need to evaluate either, or we need to treat it, or we need to at least give idea of this to this patient. Okay, so that is what the so this is actually written by me, but it is very I have taken screenshots and I'll share it in a group. Whatever I taught you, this is written. This is in written work. Okay. So nadi, mutra, mala. That is mala is what? Fecal matter. Then urine, jivha, yani tongue, shabda, voice, sparsha, touch, drik, eyes examination, akriti, general appearance. Okay. So these are 8 sthanas of these are 8 sthanas or 8 locations or 8 examinations points that should be checked according to Ayurveda. This is called Ashtasthana Pariksha, which is described in Charaka Samhita. Okay. So this is the overall case history taking and patient examination point of view. Why is it is necessary? When some patient will come to you, you will take detailed case history. That will be our first step towards yogic therapy. Second step will be you will counsel that patient about what you have gained the knowledge of their disease, their health. You will counsel them, that patient, that see, this is your disease. This is somewhat this chronic from 6 years or 3 years. So you will need to follow this diet. You will need to take this precaution, and you will be covered or you will be recovered in 3 to 6 months. And you will have to continue your medicines also and yogic therapy also. This way, you will counsel them patient. That will be the second step towards yogic therapy. And third will be you will plan a yogic therapy, detailed yogic therapy of particular patient. Okay. If X patient is suffering from sciatica, the whole history of patient, then the yogic therapy counseling of patient, then yogic therapy of that patient. Okay. In this way, we will cover these 15 to 18 diseases. Okay. सभी को समझ में आ रहा है? ओके. ये सो फर्स्ट असाइनमेंट विल बी आपके लिए होगी. किसी को एक को पकड़ो. जस्ट एक कोई भी आपके फैमिली मेंबर्स, फ्रेंड्स और रियल क्लाइंट्स, एंड टेक अ डिटेल केस हिस्ट्री. Make a PDF of that and send it in a group. Okay. I'll check it that if you have taken a good your case history taking. Okay. I will not suggest you any medicine for that, or I will not suggest you yogic therapy. Okay. What happened in last batch? They have given their complaints and ma'am अभी इसका yogic therapy दे दो. तो वो हम बाद में करने वाले हैं. Now what is the aim? That you should be more accurate regarding the patient's information, patient's diagnosis, and patient's health. Okay. And disease, the what disease he or she is suffering, you should be aware of that disease also. Okay. So you can take any disease, hypertension, sciatica, thyroid, PCOD, weight gain, anything. You can take from your family members, your real clients, yourself. आप खुद का भी ले सकते हो. Okay. लेकिन I want these in case taking format with Ayurveda view also. करोगे? किसी को कुछ डाउट यहाँ तक? Yes, yes. Great, great, great. ओके. सो मैं ये ग्रुप पे भेज दूंगी. आप केस टेकिंग, आई विल सेंड केस टेकिंग फॉर्मेट. You can write it in your notebook, or you can make their complaints and all. Okay. Okay, then done. So we'll start with new disease tomorrow. Okay. Till you should you all prepare this assignment. Okay. चलो, sit straight. एक 10 मिनट जल्दी हो रहा है, बट कल से थोड़ा उल्टा लेट हो जाएगा. डिजीजेस जब स्टार्ट होंगे. चलो, sit straight. Make a Jnana Mudra of your hands. Smile on your face. Inhale. Exhale. Inhale, whatever we have studied is fixed in our permanent memory. Exhale. Make a namaskar mudra of your hands for Shanti mantra. Inhale for Shanti mantra. Om Purnamada Purnamidam Purnat Purnasamuchate Purnasya Purnamadaya Purnamevavashishyate. Om Shanti Shanti Shanti. Rub your hands, keep it on your eyes. Gently open your eyes and Hari Om. Bye bye. See you tomorrow. कुछ भी डाउट हो तो पर्सनली भी पूछ सकते हो या फिर ग्रुप पे भी. ओके बाय. I'll send record in some 1 hour. Okay.
Bye, man.